Heart attack versus cardiac arrest, the 3D difference. See this? This incredible, tireless engine in your chest? Every single beat is a testament to its power. But what happens when that engine starts to fail? So many people use the terms heart attack and cardiac arrest like they're the same thing, but they're completely different emergencies. One is a plumbing crisis, the other, an electrical failure. And over the next few minutes, we're going to take a mind-blowing trip deep inside the human body to see that critical 3D difference up close. Trust me, understanding this isn't just trivia, it's knowledge that can empower you to save a life. Maybe even your own. Let's get into it. I want you to imagine your home's plumbing. Water flows freely through the pipes, right? Now imagine a nasty clog that stops the flow completely. That's a plumbing crisis. Okay, now think about your home's electrical wiring. What if the main circuit board just shorted out, plunging the entire house into darkness? That's an electrical blackout. This is the simplest and honestly the best way to understand the difference between a heart attack and cardiac arrest. One's a blockage, the other an electrical failure. And over the next few minutes, we're going to take a mind-blowing trip deep inside the human body to see that critical 3D difference up close. Trust me, understanding this isn't just trivia, it's knowledge that can empower you to save a life. Maybe even your own. Let's get into it. The heart attack, a plumbing crisis. All right, let's shrink down and travel inside one of the most important pipes in the human body, a coronary artery. These arteries are the heart's personal fuel lines. They wrap around the heart muscle, delivering a constant, rich supply of oxygenated blood. This blood is what allows the heart to keep pumping day and night without ever taking a break. But over years, a silent problem can start to build up inside these crucial pipelines. It's a process called atherosclerosis. The easiest way to think about it is like rust and gunk building up inside a pipe. It all starts with a little damage to the artery's smooth inner lining. Things like high blood pressure, smoking, or high cholesterol can kick it off. Your body tries to patch the area, but this fix can turn into a nasty buildup of cholesterol, fats, and other junk. We call this collection plaque. For a long time, this plaque might not cause any problems. Blood can still squeeze by. But this plaque has a dangerous secret. It can be unstable. Its surface can get brittle and crack open. When that happens, your body thinks it's an injury and does what it's supposed to do. It forms a blood clot to seal the wound. This is the exact moment a heart attack begins. That blood clot can get big enough to completely block the artery. The pipeline is now sealed shut. Suddenly, all the heart muscle that was being fed by that artery is starved of oxygen. The medical term for this is myocardial infarction, and it means the heart muscle itself is beginning to die. The person is now in a race against time, because as doctors say, time is muscle. The longer that artery stays blocked, the more of the heart is permanently lost. So what does this feel like? The classic sign is chest pain, but it's not just any pain. People describe it as an intense pressure, a squeezing, or a crushing weight like an elephant is sitting on their chest. It can last for minutes or come and go, but the pain isn't always just in the chest. It can travel or radiate to one or both arms, the back, neck, jaw, or even the stomach. On top of that, you might break out in a cold sweat, feel sick to your stomach, or feel desperately short of breath. And it's incredibly important to know that symptoms can be different, especially for women. While chest pain is still the most common sign for everyone, women are more likely to experience other, more subtle symptoms. This could be unusual fatigue setting in days before, shortness of breath without exertion, nausea, or pain in the back or jaw. Because these can be mistaken for the flu, indigestion, or just stress, women sometimes wait too long to get help, which can have devastating consequences. But here's the key. During a heart attack, the person is almost always awake and conscious. They know something is terribly wrong. Their heart is still beating, but it's in crisis. The plumbing is blocked, and the clock is ticking. The cardiac arrest, an electrical blackout. Now, let's forget the plumbing and focus on the heart's electrical system. This system is the invisible conductor that orchestrates the heart's perfect rhythm, and it's a work of art. It starts in the top right chamber of the heart in a little clump of cells called the SA node. This is the heart's natural pacemaker. It sends out a tiny electrical spark that tells the upper chambers to squeeze blood down into the lower chambers, the ventricles. That signal then hits another node, pauses for a split second, and then zips down through the ventricles, telling them to pump blood out to the lungs and to the entire body. This happens 60 to 100 times a minute, every minute of your life, without you ever thinking about it. A cardiac arrest is what happens when this elegant electrical system just crashes. It's a sudden, total blackout. The orderly signal dissolves into chaos. The most common reason for this is a deadly arrhythmia called ventricular fibrillation, or VFib. In VFib, the electrical signals fire off from all over the place, randomly and wildly. The result? Instead of a strong, unified pump, the heart muscle just quivers uselessly. It's been described as looking like a bag of twitching worms. That quivering motion can't pump a single drop of blood. Circulation to the entire body, including the brain, stops cold. The signs of cardiac arrest aren't subtle. They are immediate and terrifying. The person will suddenly collapse. They won't respond to you. They will stop breathing normally. They might take a few weird gasping breaths called agonal breathing, or not breathe at all. And because the heart isn't pumping, there will be no pulse. This is the ultimate medical emergency. Without blood flow, the brain starts to die within minutes. Death is almost certain in under 10 minutes. A person having a heart attack is awake and in pain. A person in cardiac arrest is unconscious and, for all intents and purposes, gone. Their only chance at survival depends entirely on what you do next. The critical link. So we have a plumbing problem and an electrical problem, two distinct events, but they're dangerously connected. A major heart attack can absolutely cause a cardiac arrest. Here's how it works. The damage and oxygen starvation from that blocked artery can make the heart muscle electrically unstable. That instability can throw a wrench in the works, disrupting the normal electrical signals and triggering a deadly rhythm like VFib. In other words, the plumbing clog creates so much stress that it shorts out the entire electrical grid. This is why many people who die from a heart attack don't die from the blockage itself. They die because the heart attack triggered a fatal cardiac arrest. But, and this is a big but, not all cardiac arrests are caused by heart attacks. Cardiac arrest can happen out of the blue from other things that mess with the heart's electrical system, like a thickened heart muscle, severe heart failure, certain genetic disorders, or even outside events like being electrocuted or a major blow to the chest. A heart attack is a major risk factor for cardiac arrest, but they are not the same thing. The life-saving solutions. Your call to action. Knowing the difference is one thing. Knowing what to do is everything. Your response in those first few moments can literally decide between life and death. If you think someone is having a heart attack, they're awake, breathing, but have that chest pain, shortness of breath, or pain in their arms or jaw, your first and most critical job is to call 911 immediately. Don't try to be a hero and drive them to the hospital. Paramedics can start treatment the second they arrive. While you wait, have the person sit down and rest calmly. Loosen any tight clothing. If the 911 dispatcher says it's okay and you know the person isn't allergic, having them chew an aspirin can help thin the blood. Now, if you witness a cardiac arrest, someone collapses, is unresponsive, and isn't breathing right, the situation is 100 times more urgent, and you are their only hope. You have to act in seconds. This is where the chain of survival comes in. First, recognize what's happening and call 911 right away. Put your phone on speaker so you can talk to the dispatcher while you work. Second, immediately start high-quality CPR. If you haven't been trained, just do hands-only CPR. Put the heel of one hand in the center of the chest, put your other hand on top, and push hard and fast. We're talking 100 to 120 beats per minute. The rhythm of the song "Stand Alive" is your perfect guide. Don't worry about hurting them. You are their heart and lungs right now, keeping their brain alive. Third, use an AED, an automated external defibrillator, as soon as one is available. These machines are made for anyone to use. You open the case and it talks you through every single step. It tells you where to put the pads, analyzes the heart's rhythm, and if a shock is needed to reset that electrical chaos, it will tell you to stand clear and press a button. CPR plus a shock from an AED is the 1-2 punch that can restart a heart. Keep doing CPR until the professionals get there and take over. Your actions are the bridge to life. So, we've seen the 3D difference between the plumbing clog of a heart attack and the electrical blackout of a cardiac arrest. You now get that a heart attack is about blood flow, while cardiac arrest is about the beat itself. You know the different signs for each, and you know exactly what to do. This knowledge is a superpower. Recognizing a heart attack gets someone to the hospital in time to save their heart muscle. Recognizing cardiac arrest and jumping into action with 911, CPR, and an AED can literally bring someone back from the dead. These aren't just two medical terms, they are two very different calls to action. By understanding the difference, you're no longer just a bystander. You are the first, most critical link in the chain of survival. Share this video. Talk about this with your family. Because knowing the difference doesn't just make you smarter, it makes you a lifesaver.